Hello, everyone. This is Jacob Otto, the host of Maes Medical Minute. We're going to do a quick little introduction podcast here with the namesake Dr. Maes. Would you like to introduce yourself?
Yeah, my name is Earl Maes. I am a MD. I trained at the University of Iowa. I went to the University of Colorado for my undergraduate degree, and I have a fellowship in musculoskeletal imaging and a residency in radiology. I also did an internship in family medicine, and prior to being a radiologist, I actually practiced in the ER for several years.
Awesome. I heard you have quite a few businesses. Would you like to talk about those?
Yeah, so I'm a serial entrepreneur for sure, but when I was practicing medicine at the local hospital here, I recognized a lot of problems. The quality of patient care that I was hoping to give to patients, I wasn't able to give in that setting. And so I wanted to start a way that I can provide medical care to as many patients as possible and in as many locations as possible. And so that's why I started my first company, which was Emergence Teleradiology. So it's a technology which allows us to interpret images over the internet in a secure way and provide results for hospitals that are not big enough to employ a radiologist on site. And in today's world, a lot of things are done off-site for a lot of different reasons, but unfortunately, it usually comes down to cost. And these hospitals can't afford to employ a radiologist. And so we're able to provide a radiologist that can, provide their patients the care that they need remotely. The next company that I started is called Health Hub Clinic. And one of the challenges as a radiologist that I face is we never get a clinical history. And as a physician, we know that 80 to 90% of the medical diagnosis is made purely off of the history. So the physical exam and the lab tests and all these things that we do, and even the imaging to some degree, is really to confirm what we already have kind of decided the patient has going on. And so in radiology, we're extremely limited because we don't get a history more often than not from the clinicians. And the clinicians are supposed to give us a history, but they don't. They're busy, they're seeing a lot of patients, and they don't have time to give a history. So that really puts us at a disadvantage when we read those examinations. So I started Health Hub Clinic, so that can be a link between the imaging and the clinician that orders the exam and the radiologist that interprets the exam. Because we all know that radiology is really the one that's making the diagnosis for patients. Every patient that goes into a hospital setting, they may go into the ER with abdominal pain, but ultimately the clinician in the ER is going to order an abdomen pelvis CT, and it's the radiologist that looks at that CT and says, oh, it's your appendix that's a problem, or it's your gallbladder that's a problem, or you have diverticulitis, or whatever you may have. It's the radiologist that's making the diagnosis. And so it's really unfair to both the radiologist and to the patient that the radiologist does not have access to that clinical information when they're seeing the patients or when they're interpreting the exam. So by opening up Health Hub Clinic, I can ensure that the clinicians that work in the clinic are always going to give a good history so that the diagnostic portion with the radiologist can be as clear and accurate as possible. And then the third thing we're doing is I opened another company called Health Guardian Imaging. And what that is that's a full service imaging center that will be able to perform all of the examinations that the clinic orders, or if somebody comes, they went to the hospital and their doctor at the hospital ordered a certain exam, the patient can come here and order the exam and get the exam done through Health Guardian Imaging.
So is there a specific reason outside of just what you saw at the hospital that you decided to start all three of those?
Yeah, for me, really the challenge is, when I look at hospitals and I look at insurance companies, they are definitely for profit, and their businesses, they do things legally, but they're really looking to benefit themselves. And so they're not really looking to benefit patients and care for patients. And that's where the problem is. Hospitals are making millions of dollars every year. Insurance companies are making millions of dollars every year. But at the end of the day, the patient can't afford to get any health care actually performed. When we had previous administrations, we came up with the Affordable Care Act, and I think that was a great idea. Let's get insurance for everybody. But once we implemented it, we realized that there was no way to pay for it because the hospitals were not willing to discount their prices. They were not willing to actually charge a price that's fair and reasonable to everybody. So the hospitals still continue to make large profits. The insurance companies continue to make large profits. So there's no surprise that the Affordable Care Act, even though it had great intentions, didn't really have any effect on the average person because they still could not get the medical care they want. So by forming these companies together, my goal is to provide great healthcare and medical care to patients, but I want to do it at an affordable rate. I'm not a hospital that it has to worry about making millions of dollars every year. I'm not an insurance company that has to make millions of dollars every year for its shareholders. I want to take care of the patient, and I'm going to charge a price that is reasonable for the service that they get provided. And it's going to be just as good a quality as if they were seen in the hospital or any other clinic.
No, that sounds amazing. Put the patient first. Is that how you see the future of healthcare, with the patient first?
Yes. So healthcare is definitely going to change. I think the healthcare industry has not responded fast enough for the technology that's coming out with AI and the internet. Patients look up their symptoms long before they come see a physician. And so we're used to the physician sees the patient, tells them what they have, makes the prescription medicine or orders the test, and we send them on their way, and we have them follow up in a couple weeks, and maybe they get the results in two more weeks, and it's wait for the results. And patients are a lot smarter than that now because of the internet, because of AI, things like that. Half the time the patient already knows what they have before they even come see the clinician. And so we really need to find a way to streamline the healthcare process so we're not making patients wait 2 to 4 to 6 weeks just to get an imaging exam done or to wait to get their labs back. I've heard of patients that they get labs done and it may take 1 to 2 weeks to get the results. And if they get a head CT or a brain MRI done, they may be waiting 3 to 4 weeks to get the results. And that's not okay. That should not be an accepted standard of care. So doing what we're doing, we're utilizing a lot of technology. And that technology has to do with the way we efficiently check patients in, the way we efficiently follow up with patients, the way we link the lab results and the imaging results and the clinical findings all together, and it's all accessible in the same platform so that we can do things in an efficient manner. We don't want the patient to have to come back in 4 weeks to get their results when there's no reason we can't give them the results today. And so we're really going to make healthcare streamlined. We're going to make it affordable, and we're going to make it accessible to everybody.
Care seems to have gone to this telemedicine and virtual appointment route. Is that something that you believe is beneficial, or is there a place for that, or is that too distant, do you think, for healthcare?
I think telemedicine is absolutely beneficial for the patients because right now, if something happens after 5 o'clock, if you get sick or you have an injury after 5 o'clock, the only option you have is to go to the emergency room. And that's not necessary most of the time. Now, there are certainly indications for an emergency room visit. If there's a trauma or a major health condition, yes, the emergency room is the best place. But if you have someone that just has a cold and fever, or they sprained their ankle, or any of these things that are more routine, they can certainly be done utilizing telemedicine. So we could do it a full discussion with the patient, because again, going back to 80 to 90% of the diagnosis is made off the history alone. So we can take the history via telemedicine appointment with the patient. We can have a really good idea what needs to be done. And then we can schedule, if it's an injury of the ankle, we can schedule them for an x-ray first thing in the morning. We can give them medication for the pain via telemedicine consultation, because we can just call the medication into the pharmacy that's nearest to them. So telemedicine will provide care to patients off hours, but also during the day. Why do we have to miss a half day of work to go see our clinician? You shouldn't have to miss that much time from work. You should be able to do a scheduled appointment, show up at your scheduled appointment on a telemedicine call, and get your clinical needs taken care of. It's just not reasonable for a patient to have to miss a half a day of work just to be seen. So we do all that. We utilize a lot of technology, a lot of the programs we've developed ourselves. But what we're doing is we're connecting everything together and we're making it as efficient as possible. So people, if they want to come in and be seen in the clinic, they can come in and be seen in the clinic. But if they're not able to take time off or it occurs after hours, they can do a telemedicine consultation with us. We can take their history, decide what they have, order the appropriate tests, and still give them the appropriate treatment and follow up the next day.
It sounds amazing. You mentioned how the radiologist and the clinician can work together between Health Hub and Health Guardian, but on the website, there's a lot of talk about preventative healthcare. Can you explain that?
Absolutely. That's a great question. So preventative healthcare is also an area that's going to become more and more prevalent. I think as we transition in medicine and what we know, we went from a situation where we were making a diagnosis and then trying to make a treatment for the condition that already exists, to where we're at now is we can predict the diagnosis or screen for the diagnosis before the patient even becomes symptomatic. So there's so many diseases that we can diagnose it when the patient is just starting to develop symptoms, and then we can give them a treatment that's going to treat that condition and prevent it from ever becoming a major health problem. So in America, we've all heard of somebody that was in their 50s. They were a pillar of health. They were running around like my friend Rob Yanders, and best shape of his life, and then one day he just drops over dead. And there's no reason for that to be happening when we can screen for all of these conditions. Rob Yanders was a guy that was 43 years old when he died. He was a professional athlete. He played college basketball. He played professional basketball. He was in the best shape of his life, and suddenly he drops dead in the middle of the night. And he had a condition of his heart that could have easily been screened for and could have easily been treated. And guess what? After they discovered what he died from, we went back and looked at his family members, and he had a sister that had died about 6 years previously from a similar condition, but nobody realized what it was. So we went ahead and screened all of his family members, and his brother had the same condition. And so now his brother was able to get the treatment that he needed so that he can stay healthy. But that's just one example. There's so many disease processes that we can screen for. We can catch it early and we can treat it. And that's the important thing, is now by using these screening programs and screening exams, whether it's imaging or labs, we can prevent the disease from even really progressing in that patient. We can't eliminate it entirely, but we can absolutely slow it down and make it to where it's a minor condition in their life rather than something that kills a father of 2 children in his early 40s. Totally unexpectedly. That cannot continue to happen in our society.
Awesome. So if we're saving lives with preventative healthcare, is there anything a normal consumer or patient in their everyday life can start taking steps for to prevent things at home?
Absolutely. As we're learning more about nutrition, supplements under the supervision of a clinician is certainly something that we can be taking, we can utilize. We've all been told, hey, you should be taking calcium, you should be taking this vitamin, you should be taking this vitamin. But there's not really a person coming together and saying, hey, let's talk about this and why it's important to take these vitamins. Why is it important to make sure you take vitamin D with your calcium? Well, it's because it helps your body absorb the calcium. And if you don't take the vitamin D, you can take all the calcium in the world, but it's not going to be absorbed and ultimately lead to strong bones. And so all of these things should be addressed for patients. I saw a patient the other day. She was taking a high dose of vitamin D because she was osteoporotic. She had the so-called old bones and the weak, fragile bones. So it was great. She was taking vitamin D, but she wasn't even taking calcium. And so she's got part of the message, take the vitamin D, but she didn't get the rest of the message, which is the vitamin D doesn't do you any good if you don't take the calcium. So you need to do all of these things. There's screening programs out there that we can screen for a multitude of diseases. We talk about right now screening for lung cancer, and there's a reason that it's not recommended to screen for lung cancer. And insurance companies really control this. They want you to say, oh, well, there's a risk of radiation every time you get a chest CT, so we don't think it's valuable to screen for lung cancer. But the reality of all of this is it's cheaper to the insurance company to pay for the treatment for the 10 people that develop lung cancer than it is to screen the 100,000 people for lung cancer. And that is the reality of why we don't do screening chest CTs. The dose of radiation you get with a chest CT is very minimal. It's not a high dose at all. It's a very low dose. The exam is set up in such a way that it has a very low dose. And we talk about the radiation dose in that setting, and we scare people. And so people are like, well, I'm not sure I should get a chest CT because there's radiation. Yet that same patient, if they're in a minor car accident and they go to the emergency room at the hospital, we know that that same patient is going to get a head CT, a cervical spine CT, a face CT, a chest CT, an abdomen CT, abdomen pelvis, a thoracic spine, a lumbar spine, and probably a pelvic CT and a CT angiogram of their neck. And this is for a minor traffic accident. I can't tell you how many CTs we read for patients in the ER setting through emergence teleradiology that are completely normal. And that same person may have another fender bender 3 months from now, and they order all the same CTs. And we don't talk about the radiation dose in that situation, but we're worried about the radiation dose of a simple exam that can save people's life, that can prevent people from getting cancer, or when they get cancer, it's totally preventable. And the example I can give is of my own mother. My mom was diagnosed with lung cancer about 4 years ago. She had a chest x-ray done in her doctor's office, and they said, well, there may be a nodule there. We're not sure. Let's just follow it up in 6 months. But my mom, being smart, she said, hey, I have a son that's a radiologist, so I'm going to show him the chest x-ray. And I looked at it, I said, yeah, Mom, this is not just a spot. This is not something you ignore. Let's get you a chest CT. So she went on to get the chest CT. And again, we went back to the clinician. The clinician said, well, you're really low risk. You've never smoked. You haven't had any exposures. You don't have any risk factors. So therefore, we're going to assume that this is something other than a cancer. Let's follow you up in 6 months. And I came back and I said, no, Mom, this could be cancer. This looks like cancer to me. We need to pursue this further. And ultimately, she went to the Mayo Clinic. They took the nodule out, and it was adenocarcinoma, which is absolutely lung cancer. But the difference is she was able to get her lung cancer removed when it was 18 millimeters. It's tiny. And because it was so small, they could just take a little piece of the lung out. And she is now completely cancer-free, has total functional ability. She can breathe, she can exercise, she's fine. Had we waited 6 months like her clinician was asking her to, that cancer would have absolutely grown, and it could have gone to other parts of her body. It could have metastasized. So that's why it's so important to screen patients so we can catch that cancer when it is 12 millimeters, 16 millimeters, or in my mom's case, 18 millimeters. That's when we want to catch the cancer. It doesn't do us any good to catch cancer when you say, yeah, there's a mass in your chest that's as big as my fist and it's gone everywhere else. What can we do at that point? It's too late. We have to catch it when it's treatable, when it's preventable, when we can actually do something to improve the outcome. So yes, insurance companies are not very often going to pay for a screening chest CT to look for lung cancer, but patients should absolutely have that exam done. It's good common sense. It makes sense for everybody to get this done because we are going to all have the chance of developing cancer in our life. And we need to diagnose it as soon as we can. And that's just one disease process. We can diagnose heart disease at a much earlier rate too. We all hear about people that drop dead from a heart attack. There's no reason for that. We can screen for that. We can screen for the amount of calcium in your coronary arteries, so the arteries that supply the blood to the heart. We can look at the amount of calcium and tell you you're at high risk, you're at low risk. We can check your lab work, check your lipids, and that's what we really focused on in the past. But that just gave us a small indication of what might happen with cardiovascular disease. But now we're to a point we can actually do the imaging that will tell us exactly what the risk is. If we see a lung nodule on a chest CT, we know exactly what the risk is of that becoming cancer. And that leads to the other problem we experience in healthcare is radiologists have a very clear, standardized method of looking at the images. And if they see a nodule, they know exactly what it is and they make a recommendation. It's all been well worked out with lots of clinical trials. We make a recommendation. And so in the case of the lungs, it's called a lung RADS score, LUNGRADS score. Based on that score, we can tell you what your risk is. We can tell you how you should be followed up. We can tell you what treatment it is. But oftentimes, the clinicians don't know what the lung RAD score is. They don't know what it means. Evidently, they don't have time in their day to go onto Google and see what lung RADS means. And so we see clinicians that are not even following the recommendations of the radiologist to follow up the lung nodule. I can't tell you how many times someone has got a chest CT and we see a nodule. We recommend a 6-month follow-up, and the clinician gets a report back and says, oh, you had a lung nodule. Well, let's follow it in 2 months just to be safe. Well, the problem is you're not being safe by following it in 2 months because it hasn't had time to grow enough to perceive a difference with our eyes. And so the radiologist is going to read that exam 2 months and he's going to say, well, it hasn't really changed since the one you had 2 months ago. Well, that's because we didn't give it enough time. The radiologist made a recommendation, follow it up in 6 months. In 6 months, we will see the change. If there's no change, we have a pathway. If there's a change, we have a pathway. But the clinicians aren't following that. And so that's why I'm bringing Health Hub Clinic and Health Guardian Imaging together so that I can make sure that all of the clinicians that I work with know how to follow up the imaging results that they get from their radiologist.
Yeah, that sounds like a super important thing. I know personal experience. My mom died of cancer, and it was something they tested for and said she'd probably be okay. And then the next year, she just completely wasn't. So that sounds like a super important thing for us to really pay attention to. You mentioned earlier the Affordable Care Act and insurance a few times and making sure your provider understands a certain thing. Is there anything a consumer should look for as open enrollment season comes up and they could be switching insurances and possibly needing to find a new provider?
Absolutely. So when you're out there looking for your health insurance, it's great that more businesses are offering health insurance, but the problem is oftentimes the patient can't afford it. Current premiums, for a single person is probably going to be around $250 to $300 a month. If they have a family, it's going to probably be closer to $1,000 a month. And for that premium, you get the benefit of having health insurance. But the question always becomes, do we really have health insurance? Because our deductible is so high. So on a patient that has health insurance and they're paying this, if say they have a family, they're paying $1,000 every month for the benefit of having the health insurance, but then they go to use it and they find out that their deductible is $3,500. So what that means is the first $3,500 of their health care, they're going to personally be responsible for. So that means if they go to the doctor, they're going to pay for it. If they go get labs, they're going to pay for it. If they have imaging done, they're going to pay for it out of pocket. The insurance isn't going to cover any of that. And when they go to the doctor to see someone for a clinical visit, they're going to pay a copay, oftentimes $45, $50 copay, even though they have health insurance. And I put that in quotes because health insurance really is there to prevent catastrophe. It really doesn't do much else for daily primary care. And so that's why at Health Hub Clinic, we have a membership where you pay $25 a month and you have access to all of the things that we provide at Health Guardian, at the Health Hub Clinic, and also the radiology interpretation. We have very clear, we have straightforward pricing for our clinic visits, $50. It's set up that way because it's the same price as a copay would be if you had insurance. So you pay $50 for your clinic visit. It doesn't matter when you do it, how long it takes, you pay $50 for your clinic visit. So there's not different pricing for telemedicine or daytime visits or evening visits or, late evening after work visits. It's $50. We have set pricing established with our Health Guardian partner for imaging so that there's no surprises there. We have set pricing for our labs. So our lab pricing is $75. And so we have it broken up into different panels, and each panel will be $75. So most patients will just need one panel, but if you need two, we'll charge you $75 for the first panel and $50 for the second panel. So we're doing our best to make things totally affordable. Where a patient that has health insurance right now, they pay their $1,000 premium, they actually need to use their health insurance. They go to urgent care or they go to the ER for a cough or a cold or whatever, And then they get a bill for the entire visit and they're left with, well, what did my insurance actually even cover? And the answer is it didn't cover any of that because you hadn't met your deductible yet. So we've set our prices so low so that it can be affordable for more people. We want patients to be able to afford to come to our clinic and get health care. At the end of the day, we want to provide patient care at the highest quality for everyone. And the only way we can do that is making it more affordable. And so by doing that, we've eliminated all of the administration. We've eliminated all the CEOs. We don't have hospital CEOs and vice presidents and presidents and all these things that we have to pay huge salaries for. And so we can do things at a much more affordable cost. We have the same imaging equipment in our Health Guardian imaging center as the hospitals have. It's the same quality. In fact, some of our stuff is probably more advanced than what they have, and it's all new. So instead of going to the hospital and paying $3,500 for the MRI, and again, it's going to be all out of pocket because you haven't met your deductible yet, you can come to Health Guardian Imaging. We'll do the same MRI. We charge you $600, a lot more affordable. If it's a CT, we charge you $400. It's set pricing that's very clear and transparent. There should be no surprises. Now, if you're a patient that has health insurance and you want to use your health insurance, you come to us and you see us like you would any other, or we see you like we would any other patient, and we just bill your insurance. We're able to bill that for you. If your insurance pays it, that's great. It's no problem. If you've met your deductible already, we just bill your insurance, and we do it just the same as every traditional health clinic and hospital does. But again, we give you access to same-day appointments. We give you access to being able to get the labs done at the same time, being able to get the imaging done in the same day, and get all your results very quickly. The other thing when you're looking at your health insurance that you sign up for is whether or not it covers primary care. Some insurances will cover primary care. Most of them will not. So what that means is the primary care service, if your insurance covers the primary care, that is not part of the deductible situation. So in other words, your primary care visits are covered and you don't have to pay anything other than the copay. And again, the copay we're talking about is $50 usually. The copay we're talking about is the $50 usually. And so that's part of the reason we charge $50, because you shouldn't have to pay more to come see us to get great healthcare. We want to basically charge you what you would be paying anyway. So if your primary care services are not included in your health insurance premium, then that means you're going to be paying out of pocket for all of your primary care visits. So whether that's a well child visit, whether it's, your kid gets sick visit, whether you need to be seen for migraine headaches or upset stomach or whatever health condition you're dealing with, none of that is going to be covered because you haven't met that deductible. So you want to make sure that you have a health insurance that has as low a deductible as possible, because that's the amount that you personally are going to be paying. You want to know what your copay is. Again, that is usually somewhere in the $40 to $50 that you'll pay every time you go to a visit. And then the third thing you want to look at is what's called co-insurance. So that's the third number that the insurance will provide to you when you get your quote. And what that means is, okay, the insurance company says, all right, you're responsible for the first $3,500 of your bill, and you're responsible for paying your copays every time you have a visit. Now, if by chance you pay that $3,500 within a given year, you've met your deductible, and the co-insurance means, but now when you get sick, we're still not going to pay for all of it. We will pay for 70% or 80%. So that 70-80 is talking about what percentage of the cost your insurance company is actually going to pay after that visit. If you go to the ER and say you had appendicitis and they saw you in the ER, you pay your $100 copay, the ER visit, maybe it amounts to $1,000, and they ordered a CAT scan and it amounted to another $3,500. So you're looking at $4,600 right there. Now, the copay insurance isn't going to cover. So now of that $4,500, your insurance is not going to cover the first $3,500. That's you out of pocket that you're going to pay for that. So you paid $35 plus the $100 copay. So we're at $3,600. Now for that additional $1,000, the insurance is only going to pay 80% of it. So now we're looking at another $200. So of the $4,500 bill, or I'm sorry, $4,600 bill in this example, you've paid the majority of it. Your insurance didn't pay for any of it because your deductible was high. The co-insurance is always going to be low, and your copay is going to be pretty high as well. So we want to prevent patients from having to go to the emergency room for routine care. They come to our clinic visit, $50. Imaging for a CT in this case would be around $400. So they are $450 in. They get the diagnosis, positive or negative. If it's positive, we refer them to a surgeon. If it's negative, there's no surgery needed. And we don't charge them these hefty prices. So coming to the clinic where we have access to everything in one place, you're talking about spending between $400 and $600 to treat your medical condition. Whereas if you went to the hospital, you're going to be looking at $4,500 out of your pocket to treat your medical condition. And this is why one of the number one causes in America of people filing bankruptcy is healthcare debt. It's the medical bills that they accumulate when they go to the hospital. They can never pay them off.
Yeah, I completely relate to that. My son got, I think it was $4,500 MRI, and then I still had to pay like, I think it was $6,000 for his surgeries.
Yeah.
It was all a surprise. So transparent pricing sounds amazing. Beyond that, I have had pretty good insurance and go to see the same primary care doctor or primary care office for the last 4 or 5 years, but it's been a different doctor every time. Is that something going to be different at HealthO?
Absolutely. So with the shortages in healthcare, a lot of hospitals and clinics have made up for that by hiring physician assistants or nurse practitioners. There's not enough doctors to go around, and that's a reality of the situation that we faced. But it's important to realize that the training that a physician assistant or nurse practitioner gets is very different than the training that a physician gets, an MD or a DO. You know, we are spending 2 to 3 times the amount of time getting trained to do what we do than what a PA or a nurse practitioner is doing. And so there are certain things that a PA or a nurse practitioner is very capable of handling, but they should not be handling every condition that comes in the door. We actually have emergency rooms in this country that are staffed purely by physician assistants. And that's a scary situation because although they're very well trained at what they do, there are limits on what they should be doing. There's a reason that a medical doctor spends 2 to 3 times as much time training. They're learning things, they're getting experience in what they're treating, and they have a lot more vast knowledge base than the physician assistants. So at Health Guardian, we do work with physician assistants, but the goal is for you to see the same clinician each time as much as possible. We have 2 MDs that work in our clinic. So we have 2 physicians and we have 1 PA that works with us currently. So more often than not, you'll probably see the MD. But if you don't, if it's something minor, that's fine. You see the physician assistant, but I want you to be seeing the MD frequently as well. So every visit that you come in, you are going to see one of 3 people, and it's the same 3 people. It's going to be the 2 physicians that are MDs and the PA. And so you start getting some continuity of care. So you know the people that are treating you, and we know you as our patient. We know what's going on in your healthcare history. We know what medications you're taking because we're the ones that probably prescribed it for you. And so we're doing this so you have a great continuity of care. Right now, when you go see a clinician somewhere else, you may see a different person each time. You may find that the only way you could be seen in anywhere less than a month's visit is by seeing a PA. If you want to see a physician, you're probably going to wait months to get in to actually see a physician. And then you get there and they still might do a bait and switch and you see a PA or a nurse practitioner. And again, for minor things, it's fine to see a PA or a nurse practitioner, but for the overall healthcare, a physician is super important because we're trained to look at the entire picture, the big picture of the patient, not just focusing on that one little ailment that brought you into the doctor today. We're focusing on the entirety of the patient. We're checking all your medications to make sure they don't interact with each other. We're checking all your medications to make sure you're on the right dose. We're making sure that you're taking the most effective treatment for the disease you have. And we're also looking at how this disease affects another disease that you may have. And you won't even realize that. We have lots of people that are diagnosed with depression, but at the same time, we haven't even checked to see how their thyroid is doing and if that's contributing to their depression. We have a lot of people that are dealing with obesity right now, and there's a lot of labs that are never being done prior to getting them enrolled into a weight loss program. And so that's the benefit of working with us, is we have a physician that's overseeing everything, that's actually overseen in the clinic, actually there talking with the PA, answering questions, and making sure that the patient is getting the best treatment, the best plan, and the best healthcare they can.
I mean, it sounds like a no-brainer to come see Health Hub. I appreciate you taking the time to sit down and explain this to everybody. In the future, we're going to be doing an Ask Dr. Maes segment, so you guys can submit questions on askdrmaes.com. That is AskDrMaes.com. So you can go there, submit questions to be answered by Dr. Maes, and we'll have some guests coming in the future. Again, we want to thank Dr. Maes for his time, and thank you guys for listening. Thank you so much.
Thank you, guys. I appreciate it. I want to make everybody as healthy as they possibly can be.